University of Delhi, and Dr. Kiran judge for the poster competition, NIHSW, New Delhi. Now, I request Jyoti ma'am to please felicitate Professor Rita Singh.
I don't know where it is. He was operating. Demystification. You can't change it.
Thank you, ma'am. Now, I request Sunita ma'am to please felicitate Kiran ma'am. Thank you, ma'am. Let's start the event by calling upon stage Vidushi for a performance on Ganesh Vandana and expression of our profound reverence for the Lord.
भाई संजय सर कहाँ है? संजय सर कहाँ है? Ox cable is not working. शिवांगी संजय सर कहाँ है? भाई वो कमिंग कर रहे हैं, उनको बुलाना, जो कहाँ गए? मोबाइल से मुझ पे लगा हुआ है।
Thank you, Mrs. for this amazing performance. I consider it a privilege to introduce our guest of honor, Professor Rita Singh, who is currently a professor at the Department of Zoology. In her career, Professor Rita Singh has taken up research and teaching positions at various places like the Department of Biotechnology, South Campus, All India Institute of Medical Sciences, AIMS, Department of Biochemistry, Dr. B.R. Center for Biomedical Research, and many others. She was recruited by the Department of Zoology, Delhi University in 2003, where ma'am is currently serving as a professor. She is the recipient of many remarkable and prestigious awards like Gay Stadium, Visiting Professor, Trans, Professor L.S. Ramaswamy Memorial Award for her work in reproductive health. Praised Award for Cancer Stem Cells and Young Scientist Award from DST, Ministry of Science and Technology. She is recognized both at the national and the international level. She has been invited to medical schools in various countries like the USA, Switzerland, and Singapore, among many others. She is a part of the expert panel in the Environment Ministry, HRD Ministry, and Indian Council of Medical Research (ICMR). Not only this, ma'am has published various research articles in high impact factor journals. Besides being an avid researcher and professor, ma'am has always worked for the health of young adults and has reached out to various communities through her outreach program. She has helped various adolescent girls in schools and colleges to understand the importance and means of good reproductive health. Now, I request Professor Rita Singh to come on the stage and share her knowledge. Please give them a big round of applause.
ये माइक कहाँ से चला सर? ये माइक क्यों नहीं चल रहा? नहीं चल रहा है। नहीं चल रहा है। अभी मैंने स्लाइड में
Okay, thank you very much, Jyoti, and the people here who are Jyoti is my first student who did PhD with me, and then the principal of this college is also my very good friend. Put it in the slide.
it's open it.
इंटरनेट में आपको इसको पहले डाउनलोड किया होगा okay we can still start. So thank you Jyoti for giving me this opportunity, and what I'm going to talk to you today or make you familiarize is nothing very serious subject, though she told me that it is a mentee kind of thing. So whatever I'm going to discuss with you, just try to hear me as as any information which is useful to you. Certain things will be very new to you. How many of you are non-science? How many of you are non-science? Okay. And how many of you cannot understand Hindi? Okay. And how many of you cannot understand English? Oh God, that's very tough. There is one girl who can't understand Hindi and one girl who can't understand English. So, but majority can understand both the languages, isn't it? So I request both the girls, wherever I slip into Hindi or English totally, you can see me later, okay? Or you can, guess from my slides, because my whole presentation is in English. Um, have you downloaded it?
It's taking time. भाई मैं ना इधर डाउनलोड करता
I can't see from the It has gone into your this internet folder. First, it has to okay.
It is opening. No, wait a second.
This is your internet. नहीं हो चुका है डाउनलोड तो मैंने देखा ऊपर हो रहा था they have to go to the download folder. Go to the download folder. वो ऑलरेडी चला गया फाइल मैंने देखा. Go to the download folder. डाउनलोड्स किस में होते हैं इसमें?
माय कंप्यूटर में होते हैं मैम, इसमें नहीं होते. माय पीसी इधर बाहर पीसी बाहर आ जाए.
आप ही कर लो बेटा, सिर्फ डाउनलोड्स करो इसमें जाके. Because I use Mac, so you can just do it for me. Just open this and now go to downloads. नीचे हाँ जो भी डाउनलोड्स है इसमें देखो RSI है. आज की डेट का कोई फाइल आया?
ये सारे आज के हैं.
नहीं मतलब वो वाला नहीं आया जो आप डाउनलोड कर रहे हो. हाँ सो देन
मैम वो क्रोम पे डाउनलोड हुआ था लेकिन.
So where is your email? Open it. That's what I sent.
Okay, meanwhile, let's have a talk with the attendees. So I would like to ask how many of you all are not from Daulat college?
Oh, nice, that's nice. Did you reach her safely?
हाँ अब इसको
Which
मैं
college?
डाउनलोड पे डालूँ मैम ये तो
Hindu
मेरे
college.
स्लाइड शो पे डाल
Any
दूँगी
other? Miranda, okay.
because it will run slow because every time it's asking for internet but once you download
See, the voice was sorted.
उसको पहले डेस्कटॉप पे आप डाउनलोड कर लें आई डोंट लाइक दिस गूगल थिंग जस्ट स्पॉइल माय मूड हाँ ये देखो है ना इसको ओपन करो आप ये डाउनलोड
They're like, it's free. It's asking to free up space because it's not.
हाँ so you're free up on your device so your space is not there on your device
It's not.
सर पेन ड्राइव में दे दूँ
And if you have the pen drive, I can put it on my laptop itself.
एक्चुअली डाउनलोड होता है तो कैसे हो जाता है
And that's the laptop.
Okay, girls, I know very slides actually. So let's start learning. So what I am going to discuss with you today is how our brain is modulated by something we always thought are the hormones which are important for the menstrual cycle or for the reproductive system to work. Okay? Which is actually a myth. You don't know that how important it is to know that how your these specific reproductive hormones, which I am talking about are steroids, okay, and it is relevant for boys and girls. This lecture is not just for the made for girls, okay. So now till now you knew that steroids, which maintain our reproductive system, are made by the testes or ovaries. But actually, the truth and the advancement has shown that it is not just the reproductive hormones which are made by the gonads, but it has a relevance for our brain development, and brain differentiation to male or female. Okay? And then it doesn't stop there. That is at the time of development, that is during the pregnancy, the child is developing, its brain is developing. After that, the child takes birth. Isn't it? The brain is immature. Then the child grows several years, then it becomes adolescent. Okay? So adolescent is the stage when suddenly your hormones start changing, and for boys it's very, very obvious, their voice changes, their hair pattern changes, and for girls it's very, very obvious, their menstrual cycle starts. But that doesn't end there. Then the life goes on, you become adult, and now you want to have children. And suddenly you realize that, oh, my periods are drying down, and then there is a problem in conceiving. So then what happened? Why suddenly my menstrual cycle was all right, then I'm just 30 and my periods are drying down, and the male thinks that he's very healthy, he has muscles, but he's not able to reproduce. So what has gone wrong in our environment and in our thought process? And how these steroids control our thought process? This is what we are going to discuss. So thought process, let's take an example. Most of the girls go through menstrual cycle, isn't it? And then one day they are very happy. Dunya bahar hai. I will win the world. I will do everything possible on this earth. And suddenly 15 days passed and the girl is just locked herself in a room, and then she sees that the whole world is against her. Mother is just holding her. No, mother is also not nice to her. Friends are all बेकार के दोस्त हैं, है ना? सब दुश्मन लगने लगते हैं. Okay? And then suddenly you feel that something which you felt that you will win the world, suddenly you feel that यार ये छोटी सी चीज भी मैं नहीं कर पाऊंगी, and then you start crying.
emotions you go through in these 28 days, isn't it? Am I lying? Isn't it the truth? So one important emotion which comes into picture is fear. डर, है ना? हमें मन में जब डर लगता है तो हम insecure feel करते हैं, isn't it? So insecurity is linked to an emotion called fear. And who regulates that you should not feel fear and you should feel fear at that particular time of your menstrual cycle? And how does a person who is so confident and strong suddenly crashes before and after on PMS? Isn't it? So now these things are astonishing to many, but nobody has thought about it. So many girls they are very friendly. Over the years I have been doing this kind of awareness. So they come to me and they sometimes feel, ma'am, I think मुझे ना depression हो गया. I think I have medical depression की problem. अच्छा बेटा बताओ क्या हुआ? I declared every 15 days I have a real bout of depression. Then I explained to her menstrual cycle and how her brain functions. She was from non-science background, but she understood it so nicely that now her depression problem is gone. So most important thing in life is to know, to become conscious of a problem and from where this problem is arising. Once you are conscious, the problem is half solved. So let us look at, if luckily my slides will be on, I'll show you some interesting pictures. So from the start of the menstrual cycle, as you said, you have seen many, similarly in males, they have mostly, they feel that it's a constant hormone which is there. Of course, LH is there and there, testosterone is formed with a uniform rate. Though during pregnancy, you will relate slowly. Okay? So now what is it that controls these things? So can you tell me what steroid hormones do you know? Can you take some names? So these are organic molecules. They are non-polar. So they can easily go through inside the cell and bind to the receptor inside, or they can also bind to the receptor outside. So that is the easy thing. Evidence of this will come later. Okay. Now we will, can you go back to the slide which I was telling them that how one's brain, these are various emotions which we go to the next. Okay. So let's look at this slide and you can see that. Okay. Okay, so if you see there, start of the cycle, you have better special skills, and then you're more confidence. Other side of it is no fear, isn't it? So next slide, please. So now in case of our brain, we have two important centers. And another is amygdala, which is just behind here. Okay, these are two neural centers which have receptors for estrogen. Okay, so now when estrogen is bound to this center, amygdala, then it removes the feeling of fear. Okay, so when estrogen is deprived and the end cycle, depression, or this period start, then what will happen is it is deprived of estrogen. So you will suddenly feel, oh God, I have confidence, insecurity, and then you also feel, क्या पहले तो याद हो रहा था, आज क्या हो गया? You understand? So these kind of things happen because our involved in storing the memories. Okay, the region gets bigger each month, and then comes back to some size. Okay, the more female hormones are floating, the size changes. Okay, then amygdala, which help us with all the kind of emotions, especially fear and decision of life and fight or flight. Okay, so this is what next slide.
Next slide.
So women, okay, and this I have already told. So now this hippocampal signaling gets affected by obesity. Your memory, your ability to store the memories. Okay, that is two parts. One, making memories. Second, storing memories. Now, once a person gains weight beyond the healthy level, what is the BMI for Indian girls?
23. 23.
23. It's not 25 or 25 is for Americans. Okay, they have different height and all. For Indian height, the healthy BMI is 23. Next slide. So now the healthy BMI is 23. Next slide. So now we come to another aspect. That is the brain development and differentiation. Come to another aspect. That is the brain development and differentiation. You thought that brain differentiation or differentiation of neural pathways. Now here I will give you two references. One is steroids and the second is alcohol. Okay. We mostly misuse these two things. Now the people, now it is relevant to both girls and boys, the people who drink from the age of 10 before adolescence, what will happen to their brain in general? This is beyond steroids. People who misuse alcohol before adolescence, they will have their neural circuits immature. So जब वो 30-40 साल के होंगे, बीवी प्रेशर डाल रही है, मम्मी प्रेशर डाल रही है, बच्चे प्रेशर डाल रहे हैं. They will not be able to handle. They will not be able to handle with their job. So complexity of life is dependent on the kind of neural circuits that are formed during adolescence. When your testosterone comes, then the estrogen and testosterone both comes in both the cases. So this is a myth which we are breaking. In both the cases, you need estrogen as well as testosterone, but it helps. But in the brain. So from where does this come? In the brain, it will come. Okay. So this is the myth during development. Normally people thought that the male will have brain of male because testosterone is there. But that is not the case. The advances show that there are specific synthesis of testosterone to estradiol by brain specific aromatase. And now this conversion to estrogen is important for brain differentiation in males. In female it is no hormone. But in males, testis make testosterone goes to the brain of the fetus or the developing embryo, and there the brain develops into. So what happens in girls? If somebody's mother during pregnancy has more androgen formation, like previous mothers or many other mothers who have hyperandrogenism, who had some hair growth and imbalance of hormones, that androgen, excess androgen in the body will get converted into estrogen in the brain of the female child. Because now testosterone is available in the brain of the female also. Now when that girl takes birth, the mother did not have PCOS, no PCOD, just had hyperandrogenism due to some hormonal issue. Now that female will have aggression and will have male-like pattern. Okay, so that is the issue which comes, and that is what is understood by, because earlier when I was taking these classes, I questioned how female becomes male pattern. So this is the reason I searched the literature, I searched everything. How brain differentiates. It made me get interested in this area. So this is the thing that if mother has estrogen, that will get converted into estrogen, and estrogen in brain will cause issues. Okay. So this is the paper in one of the very reputed journals. Cell. Next, so these are called neurosteroids. There is a whole lot of field, but not fully developed, which is called. Uh, so first, physiologist, French physiologist, Ethne Boyoli was the one who, first time published a paper on these neurosteroids, which are formed inside the brain. Okay, next slide. Now it is not just a steroid. It does not end with the steroid receptors. Do you know what is this neurotransmitter called GABA? And what does it do? It controls your anxiety. Isn't it? It is an inhibitory neurotransmitter. So when GABA is there in proper regulation, you will not feel anxious. You will not feel disturbed. कि सारी दुनिया बेकार हो गई. ऐसी फीलिंग आने नहीं देगा. Because when you become anxious, immediately GABA is secreted. It cools down the brain. So now this GABA receptor, it finds many things, but it has separate binding sites for neurosteroids. You see these kind of shapes are showing these specific location where GABA receptor is modulated by neurosteroids. Okay, so it's not just estrogen. There are other products which are formed, so they can regulate. Like here, androstenedione is also another product in between. So they all regulate not just the emotions, not just the memory, many more things. We'll come to that. Next slide. So this I have already told you. Next slide. Okay, go back once more. So important thing is here. Now I link it to the metabolism. So this GABA is not only just for emotions or anxiety and all that. GABA receptors are there in your pancreas, and it regulates the insulin producing beta cells. Everything is linking. Okay, and how many people have diabetes? Almost everybody who is 45. Isn't it? So many people. So that is also linked to high anxiety, high obesity, chances of getting the metabolic diseases. Okay, next slide. So sex steroids, they are not just important for all this, they are also important for neurogenesis, during embryogenesis, but they are also important for adult neurogenesis. आप सोचते थे पुराने ख्याल थे एक बार ब्रेन की नर्व बन गई बस उतनी रहेगी, but ऐसा कुछ नहीं है. There is one particular portion of the brain, I'm just giving you examples, there may be many more. Now this forebrain ventricular subventricular zone is has the receptors for neurosteroids, and this region which is always producing new neurons. Okay, so neurogenesis means that starting from fresh, from the stem cells, or the adult neurogenesis means already you have neurons, and some more neurons are going to form from the existing cells or existing stem cells. Okay, next slide. So these steroids are involved in every aspect of brain development, differentiation, and memory development. Okay, so this gives you all the. Go back to that slide. Yeah, this one. So now here, if you see, this is another scientist. He is Mentee, but he is in the US, who has written a very nice review. You see that here, aromatase, estradiol, NMDA, or all these neuroreceptors, and the condition these people have not been able to solve this time, or at this moment, that is the Alzheimer's and other diseases which involve anxiety, stress, depression. Okay, so this axis is very important for the well-being, for the mental health, for the physical health, for the general confidence. And next slide, please. So now we come to the second stage of my lecture, where we will see what is it in our environment which is causing us to get into trouble with our mental health? Okay. So first thing is oral contraceptives. Young girls are becoming more social, or boys, young boys, they live together. Now the whole culture of our social system at young age has changed, and then people get married and they don't want to have children so fast. They also need from oral contraceptives or some contraceptives. But the choice comes that always the female is the one who will compromise and start taking the contraceptives. Okay. But now today we will see, and most of the time doctors are advising combination pills. Combination pills have both estrogen and progesterone, and they just advise them, tell them what side effects could be, they keep taking continuously. And now these OCs, if you take more than a year, then what happens? I will show you that, and that is not just guessing game or just I'm telling you for awareness. I have already indulged into some kind of basic information from the cases, and I found this to be true. So now basically it's a true. So birth control, next time, and all these things. And then these are the kind of side effects which medicine will always be there on the backside of it. But then what actually happens to you in a long term use? If you take for say few months or a year, you kind of necessity, then it's all right. But then next slide. What these OCs do is they interfere with your brain, and then they interfere with your most important organ, which is the thyroid. Thyroid hormones don't have any specific work to do themselves in a nutshell, but they are required for everything in the body. They are required to maintain temperature, they are required for metabolism, they are required for mental health, they are required for reproduction, they are required for everything. If you have hypothyroid, you develop cyst. If you take hormone, androxin, or these hormones will be alright. So any deficiency or hyperthyroid means more hormone is formed or is being available, then you have heart palpitation. You will have anxiety. So now what happens with OCs is that it interferes with thyroid, and then you start having these problems. Anxiety, palpitation, and all those things without having any much hyper. It makes you sensitive to these hormones. Next slide. Next slide. And then there is another problem which comes, which is that estrogen is a carcinogen. Just take a look. All cancers are of the reproductive organs in females are first checked for estrogen receptor. Okay, whether the patient is estrogen receptor positive for this breast tissue or the liver tissue or progesterone positive, like that. So now here if you see if a person constantly keep taking, within a year they be more susceptible to breast cancer. But some doctors say that these females may be to sell their products. They say they are saved from ovary cancer and endometrial cancer, but they don't tell you that you are more prone to breast cancer. those से बचा लेंगे लेकिन एक से मार देंगे. So the question is like that. But then next slide, it doesn't tell you immediately. Now this, if you keep taking for many years, then you become susceptible to another problem, which is that blood clots will form in the body. You see, many women have varicose veins. वो क्या होता है? छोटे छोटे क्लॉट बनने शुरू हो जाते हैं बॉडी में. वो जाके कोई कोई वेन्स को ब्लॉक कर देते हैं. And there only the blood will start accumulating, toxins will start accumulating, and then they will have kind of things which are called varicose veins or something like that. Okay, but then on top of that, there is increased thrombosis, and then you can have a heart attack anytime. So young women dying of any heart disease means that there is some issue with the thyroid hormone levels in her body. Otherwise, women are thought to be more protected from cardiac problems. Next slide. So here it only shows that the chances of having heart attack increases, but that you will नो एट द एज ऑफ 40 to 44 तब तक तो खत्म हो गया लाइफ अब क्या करेंगे वापस नहीं जा पाएंगे ना so this you have to know before making the choice of contraceptives there may be better options but those options may be accepted by the boy not by the girl because the girl have to take any of hormones only. So those hormones will interfere somewhere in the brain. If you take only progesterone pill for a long time, your immune system will be depressed because progesterone is a immunosuppressor, estrogen is a immunostimulator. So when it comes naturally during the cycle, it will not harm you. But when you keep taking one of them or both of them, somewhere it is going to mess up in your immune system or in your heart. Okay, next slide. So, there are many conditions when you should still not take, even if you are taking short term. So, even the women who are in 30s, 40s, so if they have any of these problems, that is after the childbirth and all that, they should not take, or they have seizures or epilepsy, they should not. And if they have hypertension or something like that. Next slide. So, in this case, how do you solve the problem? So females have to be supported by their boyfriends or the husbands by taking the precautionary way of contraception and not forcing the girls to such harmful chemicals or the oral contraceptives which are anyway cannot be taken for years. So if it is few months, so that's why planning pregnancy after marriage is very important because you will have one child and the second child after 4 5 years, so your life is more comfortable than just having more seeds and then finding that you're not even able to reproduce one. Next slide. So then what are the other environmental exposure to estrogens which are messing up with us? So let us imagine one case. One pregnant lady has a female child in her womb and now she is also drinking more estrogen. Okay. I'm saying drinking estrogen, so it's obvious how they are drinking estrogen. So then what happens to the female child? As I explained earlier, estrogen will go to the brain, flowing very fast to the blood-brain barrier. It's a small molecule, organic, cannot be stopped by anybody, and going to hit the brain of the female child to make the male child brain. Okay? As I explained to you, that is how male child brain is differentiated. But if it is normal, no estrogen, then it will not interfere with the brain centers. So here it shows that if a young girl after birth brings estrogen, then she will have anemia or will have the older ladies will have their uterus lining thickened, they'll have intermittent bleeding during the cycles, and I read that almost 70 to 80% women in 45 to 50 years have already got their uterus removed in today's time. Go and ask, they have problems of intermittent bleeding or after menopause bleeding. Also, there are problems. Okay, next slide. Last slide. Okay. So, but then if we keep drinking these estrogen during adulthood, it can make you develop polycystic ovary syndrome or estrogen dependent tumors. As I told you, estrogen is a carcinogen, whether you drink it from outside or creating excess. And the fourth thing which I have not written here, I have just written three things. But another thing which is synonymous to hyperestrogenism is uterine fibroids. Every woman has multiple fibroids in their uterus these days. Earlier, they never used to have. Yesterday, someone told me I had a lecture in Maharaja Abdul College, and one of the teachers who is in her 50s, she told me she has 55 small fibroids in her uterus. Can you imagine? I had never heard of that. One of the teachers who is in her 50s, she told me she has 55 small fibroids in her uterus. Can you imagine? I had never heard of that. So this is the kind of problem which arises because of hyperestrogenism. Okay? Next slide. So I will give an example of how environmental steroids, because environment will have mix up of everything, not just one. So this is one of the very old study by Daulat. where he picked up fish from some place in the river where it was exposed to some factory effluent which he thought was bioactive. And there he found that male fishes had intersex. What does intersex mean? Intersex means that the same fish had both ovary and testes. You understand both male part and female part. Next slide. So here you can see that in the male fish testes there was a oopa. So this was a surprising finding which he published in this paper. और पुराने ज़माने में कहते थे लोग कलयुग में तो आदमी भी बच्चा पैदा करेंगे. So this is how at least male fishes started. It's not yet reached the human system. Next slide. So now these are all mind-bending chemicals. As I have explained you, now it finds relevance to you how environmental estrogens or the androgens can do mind-bending. Okay. So there are many anti-androgens in our environment. There are many, but I'm mostly focusing on estrogenic this thing because next slide, estrogen can deactivate. How many of you know that plastics are estrogens? How many of you know that plastics are estrogens? Nobody?
I do.
Only one. बड़े ग्रुप का दिखा है मेरे लिए. एक पीछे दोनों. So this is a news to you. Keep it in your mind that bisphenol A you have heard of. You have heard of bisphenol. Other type of bisphenols are also there. All plastics and PVC products. They have mix of plastic and PVC. So plastic does one thing, that is an estrogen, but it is a half estrogen, approximately. I'm not telling you exactly how much, but it has activity less than estrogen. So when you are in reproductive age and you are drinking this plastic, your actual estrogen is half of you. So slowly your period will dry down. Normally it should run for 5 days, but now it may dry in 5 days, but now it may dry in 3 days. So this is because your drinking of environmental estrogens are making your endogenous estrogen half working. Okay. So, and what is PVC?
Polyvinyl chloride.
Polyvinyl chloride. Put it in the chemical data bank and it will tell you it's a severe carcinogen. Everybody talks about yesterday one speaker was telling पिज्जा खाने से कैंसर होता है. पिज्जा खाने से कैंसर नहीं हो सकता. वो खाना है उसमें कार्सिनोजन नहीं है लेकिन जो मैदे की वाइटनिंग के लिए यूज होता है. That chemical, do you know the name of that chemical? That chemical is dibutyl. What acid is that? That is possibility. Now the second thing is that if that has environmental chemicals like PVC or anything like that, PVC is there ऊपर एक काले रंग का टैंक देखते हो ना उसका अगर आप पानी पीते हो तो समझ लो कि सब मिक्स अप आप पी रहे हो. Everything you are drinking. So PVC is a carcinogen, plastic is a estrogen. दोनों carcinogen ही हो गए ना. But then when you are drinking, some amount of it will get detoxified in the body. You will have some other part of it. अब इस इंसान की बॉडी में वो क्या रिस्पॉन्स दे रहा है वो वैरी कर रहा है. इसीलिए लोग ह्यूमन पॉपुलेशन में इनके एडवर्स इफेक्ट्स को सब्सटेंशियली फाइट नहीं कर पा रहे. In front of the money billionaire industrialists. Okay, but then there are millions of papers. Now it is very well established. And research in my lab, I became more proactive with this, and my PhD is completely on this. And 2 aspects we have found, which I don't reveal at this time. Once she publishes those 2 aspects, then I will, from that onwards, I will start telling. It is amazing that how it affects your soft tissue like heart, liver, and kidney. Your non-slowly by 45. So these 3 things are regulating, specifically liver, is regulating your immunity, your energy, everything. So it is, and then there is non-stickware. This is so harmful for the stomach and intestine. I will give you an example. One of my PhD students, she's unwell, she's unwell. I thought PhD student ऐसे ही करते हैं, हमेशा unwell बैठ के मजे करते हैं. But then slowly I saw her tummy was little bulging. I asked her, "Are you married? Are you expecting?" She said, "No, madam, I'm having too much stomach problems." Then she went home to Kerala. She came back, and that time I was doing one awareness camp where I have pamphlets also. When I do it, I distribute pamphlets and it has information. She said, "What are you talking about with non-stickware?" I told her this is very harmful. Plastic is getting released when you make one single fry or when you make one dosa. You are drinking more than any possible toxin presence used in this non-stickware, and when it reach up everything will be released. She said, "Madam, shall I tell you something?" बताइए. Now she told me that her Masi is a maniac. She had every button in her rasoi is non-stick. She said everything in my Masi, like she was staying in her Masi, everything was non-stick. And I requested her, please save yourself. Then she shifted into a nursing hostel because she was a Kerala. She knew a hostel in Karamba. And then she finished her PhD. No problem after that. So that's how I have also learned over the period with my wellness camps and questionnaires and many things. I have also learned so many live examples of these things. Next slide. So they get released because it's organic molecule. It cannot dissolve as such in water, but then the water gets heated up with a plastic like in microwave. There is no plastic safe when you microwave it. Then it gets released into the water. This BPA or BPA, different kind of its isoforms. Let's go to the next slide. And then, so now we made an animal model that PhD student is giving BPA in water to these animals. And amazing things it's moving at such low concentration. Can you imagine? Nanograms. So, and it can bind to not only estrogen receptor, but it can also bind to some other receptors as well. Next slide. So it can have both effects directly and indirectly on the ovary as estrogen. So it will kill the ovary directly and it will kill your neuroendocrine system and it will just affect your pancreatic beta cells. Initially, BPA can increase insulin. So you'll feel gaining weight and becoming healthy and then slowly your pancreas will also crash. Next slide. So this is the slide where I show you how during pregnancy estrogens go into the body of the growing child. Then at different stages of pregnancy, one thing is that many pregnancies, they are not reaching more than 9 months also. They are preterm births. Okay. So that is another thing which happens. And then if a pregnant lady doesn't take precautions, अब उसको बाहर ही खाना है, तो चटपटा ही खाना है, काले सेब आपने देखा है ना, आप जब ऑर्डर करते हैं बटर पनीर, है ना, कढ़ाई पनीर, बटर चिकन, वो काले सेब को भी मन हो क्या है, गरम गरम आप खोल तो मजे से खाते हैं, तो क्या खा रहे हैं उसके साथ? So you can imagine, in my house, it is never allowed. You want to eat, let's go to the restaurant. Okay? So similarly, during the pregnancy, which next thing, so whenever there are critical windows of exposure, and they will affect that particular system in the child. Mental health, yes, then sexual health, yes, but then many other metabolic health will get affected. You see, they can have low body weight, they can have obesity, they can have depression and hyperactivity. Later in life, they may have insulin resistance. Many things and all complex work. You see that each and every reference I have put there. It can cause a lot of. Next slide. Next slide, please. Go back. So this slide just shows you how these estrogens can also mess up with the neuroendocrine system. Just one slide I have here. There is a center above the pituitary in the brain which is ABPB, center of the brain, and that has many controls over the neuroendocrine system, which also get messed up because of the receptor being there for estrogen. So this is all the reproductive axis, which is messed up widely. Same thing happens with males. So what will happen? If you go to the hospital, find many of the people coming with their subfertility. Means sperm count has gone down, their semen is not good quality, some problem or the other, and they go for IVF, and I get the samples and I do research. So it's very happiness for me that there are more patients, but then that is very sad situation. That how infertility has increased over the period. That how infertility has increased over the period. I started this research in 2002, and now there are so much increase. In fact, competition has increased. Now every doctor wants to work on PCOS. Every doctor wants to work on infertility. So that's good. But then I got my competition. Next slide. So these are many other endocrine disruptors which you can see in the internet. Next slide. So important points. Children, why they get so much affected by environmental estrogens or the pollutants? Because they have immature blood-brain barrier. Normally, we have a detoxifying system in our body, like kidney, liver. So what happens is all the organic molecules they are converted into the polar compounds, and then they are excreted, dissolved in water to urine. But then children have this problem of immature blood-brain barrier and the detoxifying system, toxification system is also immature. So it does not have all the enzymes and everything being expressed, and all those proteins are not placed at the right place. So they are still, their kidney is immature, liver is immature. That's why we have to take care of all the time. So this is that same slide, you can look through. Next slide, where they get converted into. So this is what I work on, which is also the PCOS and PCOD. But sometimes girls have this problem of डर जाते हैं. जैसे cyst का है, ultrasound में वो डर जाते हैं. Cyst is not a cancer. Okay, first thing to cyst means no bump हो गया, and water is filling in that cyst. So there is no chances that PCOS women get ovarian cancer. Okay, they get uterine cancer, but not the ovary. Ovary may arrest growth, and that's what is my whole research is about. But next, so the follicles in PCOS women get arrested at the pre-enteral stage. But now water starts filling in that, those cells don't grow. Okay, next slide. But then over the period of time, these women develop obesity, insulin resistance, and all those metabolic problems. Next slide. Okay. But then you must distinguish, is the PCOS or is just a simple problem? PCOD means किसी एक वजह से हो रहा है. Like I told you earlier. Hypothyroid condition, अगर आपने एट्रोक्सिन खाना नहीं शुरू किया, एट्रोक्सिन आपको नहीं मारेगा. हाइपोथायराइड में आपका इम्यून सिस्टम खराब होगा, आपका मेटाबॉलिक सिस्टम खराब होगा और आपका सेक्सुअल हेल्थ खराब होगा, क्योंकि आपकी ओवरी में सिस्ट बनना शुरू हो जाएगा. बट अगर एट्रोक्सिन खाना शुरू करोगे तो स्टॉप हो जाएगा. And then similarly, you have many causes of PCOD, like protectin high हो जाना, septicemia. Now because of environmental exposure कुछ भी हो सकता है. You have to get yourself diagnosed कि क्या ये एक किसी एक कारण से है, तो PCOD हो गया. But if it has androgen high, hair growth and many other things, then it's PCOS, but that takes time to diagnose. Next slide. So this is how this chart is available on the internet. You can always take it and see whether your hair growth is ऐसे extension नहीं लेना है. 2-3 जगह पे adolescence के होता रहता है growth ज़्यादा. But only if you have number more than 8 or something, then it may be useful. But this is the chart you can follow yourself personally in your room and see whether you have any such problem. So as per the hair growth, the number is given. So whichever location, whatever type of growth you have, keep adding the numbers. Next slide. And then now the relation between PCOS and BPA. Now people who have high androgens, boys, They also have the susceptibility to accumulate PTA. This is already shown. How it is that if you have androgens, BPA will accumulate in your body. High androgen levels, you are natural high androgen. It will decrease the detoxification system, UGT, enzyme. Okay? So in that, what will happen? You will accumulate BPA or other organic compounds, but they will not be cleared from your body. Similarly, in PCOS women who have hyperandrogenism, they will also accumulate. So that is the problem. People are, all the companies are saying that whether it is because of the PCOS or whether it is because of the BPA, there is PCOS. So they always keep confusing. But this is the fact that if you have androgens, you will accumulate BPA because of the effect on the detoxification system. Next one. So this is just for your curiosity, and the person goes for IVF. They take hormones, their ovary look like this. 4 follicles develop होता है सिर्फ, mostly 2-3 भी होता है. But in PCOS or cystic ovary, you see how many follicles will develop, and obviously that's why chances of having healthy oocytes. Although PCOS don't have problems with oocyte health, but they may be metabolically malnutrition. So eggs are malnutrition in PCOS. So one has to now there are other remedies which people have started. Even my research has contributed a lot in that. Next slide. So in these type of girls who find that the period start and then they stop, and doctors say maybe she's susceptible to PCOS. She has acne, she has hyperandrogenism. Then further studies for 1 year is 6 months to 1 year will keep you healthy rest of your life. How? Now during the adolescence when your menstrual cycle stops, it means your estrogen is not forming. Your neuroendocrine system is not getting the feed. Because that has to feed two things. One, timing, which is there in the front in the brain. That's why ovulation उसी दिन होता है, period उसी दिन start होता है notification को. But now if you are, so if you keep taking contraceptive, at least your neuroendocrine system will not get there. If your neuroendocrine system is not moved, like आप अपना spectrophotometer on करते हो तो पहले blank करते हो ना उसे, ये standard का बनाते हो, इतना बड़ा है ना? तो आपने standard का कभी बनाया क्या PSC में? So similarly, our brain has gone through that during our adolescence period. So that's why it's important that you take contraceptive if a girl has chance of PCOS. Next slide. So this is my most concluding slide. So here that's what I have already told that the oocyte have malnutrition in these diseases or in the exposed women. Next slide. So that's why it is important to have know about it and have the awareness that these things can be a problem. Next slide. So that's why we have been doing a lot of awareness in this regard in schools and everything. Next slide. So girls, young girls in school, they have this, poster formations and other things, and then they learn a lot. Next slide. Keep touching the slides. This is in your college somewhere back. So this is in the village which is adopted by the university. We have gone. I did training for my reproductive endocrinology students, master students. We have a program. Final year they study reproductive endocrinology and reproduction. So they go there. With the help of the Department of Social Work, they learn to connect with the community and the children and everybody. Next slide. So these are some important reads for you on the topic. Next slide. Yeah, this is just my labs. So these are all the different things which are important for you to understand, not get scared, but wisely think about it, where all you are getting exposed. Because it is not today that you will receive the problem, but then many people are getting issues very fast these days, within few years. So that's it. ask me any questions if you would like.
Thank you so much, ma'am, for your golden words. If anyone has any doubt or query, please ask, ma'am.
We are loading with so much information, I think there is some.
Any questions?
They are shocked. Any questions? Boys? No questions. Girls? I'm not disappointed with my lecture that it is the female hormone which is making your male brain. I'm not disappointed. Yesterday one boy really troubled me. He got very emotional about it. That was in Maharaja College. Yesterday only it was just the same kind of lecture. But he got very emotional. He was trying to ask me every possible question. He still तो हमें परेशान कर सकता है. So then I told him, look, it is the importance of bioactivity and that's why nanopicomolar concentration of estrogen can cause change. And if you within few seconds leave aside the detoxification system, it will come into play after many minutes or many hours. Okay, so that is the main thing. That's why this is important for all the youngsters.
Okay, so I would like to invite Dr. Jyoti Tanisha ma'am for a vote of thanks and a token of appreciation to Ritu ma'am.
आपकी पीपीटी में इमेजेस नहीं आ रही है, मेरे में आ रही है, इस लैपटॉप में नहीं आ रही है। अभी मुझे
Girls, please settle down. We have the top doctor with us. Respected dignitaries, my dear colleagues, and all dear participants, I welcome you all to this one-day Mentee program on demystifying the importance of sexual health in women. Although men are also here, but we are talking in general. It's an honor for me to invite Professor Rita Singh, who is my own mentor at the Mentee program on importance of sexual and reproductive health. Thank you, ma'am, for enlightening us and enterprising health. I'm sure students have learned a lot and they will go back and they do some changes in their lifestyle. And now we have Dr. Puja Sharma and Shivangi will carry through here.
Dances have been an integral part of our culture to express varied feelings and emotions. So, I invite Africa for presenting a classical dance form, Satriya, a work primarily version from the production Prakriti Purusha. The piece celebrates the female energy as a microcosm of Purusha giving birth to a life force.
शिवांगी प्रोजेक्टर वायर आई थिंक डिस्कनेक्टेड आई थिंक प्रोजेक्टर तो फिर भी ऑन ही रहेगा बट वो बाद में खोलने को प्रॉब्लम हो
Thank you, Hansika, for this amazing performance. Now, with due respect, I invite on stage Dr. Puja Sharma, who is a highly esteemed gynecologist in Delhi. With a profound dedication to women's health, Dr. Puja specializes in delivering comprehensive services with a primary focus on high-risk antenatal care and delivery, advanced gynecology, laparoscopic surgery, cosmetic gynecology, and infertility treatment. Dr. Puja has successfully managed numerous high-risk pregnancies, demonstrating her unwavering commitment to ensuring the well-being of both mothers and babies. Her expertise extends to performing advanced laparoscopic surgeries, offering minimally invasive solutions for various gynecological conditions. Dr. Puja's exceptional skill in cosmetic gynecology enables her to provide personalized care and empower women to enhance their confidence and overall well-being. I express my heartfelt gratitude to you, ma'am, for accepting our invitation and agreeing to come out, taking time off to this schedule. Thank you so much, ma'am.
Thank you so much, dear, for the kind introduction. May I know your name?
Shivangi.
Shivangi, thank you, Shivangi.
Now we have felicitation for you by Sonika ma'am. I request Sonika ma'am to please come up on the stage for the felicitation.
Center.
Thank you so much, ma'am.
Thank you for that honor. And the pleasure is all mine to be there with this 21st century and millennium crowd for girls and boys in the age group of 17 to 23, maybe. Okay. So this talk of mine, this session of mine, I'll be seeking help from all of you. I want it to be as interactive as possible. Let's keep it interactive session and I'll be seeking your help. Please be bold enough to put your doubt. The only question that is not relevant is the question that has never been asked. Rest all questions are relevant questions, remember that. Okay? So can I count you all in? Can I see the thumbs up? Still I cannot see. Great. So today I'll be talking about reproductive tract infections or problems related to female reproductive tract mainly and the sexual issues related to that concern. So as you all know, many of you must be knowing the anatomy of female tract, right? So just to revise, we have a hypothalamic pituitary ovarian axis and the reproductive organs, right? So hypothalamic pituitary ovarian axis means there is a control of brain over the reproductive organs. So whenever there is increase or decrease in any form of hormone, as ma'am has beautifully talked about in the previous lecture, that whenever there is any discrepancy in the level of any hormone, your brain gets a feedback signal, and that's how the body reacts. So hypothalamus sends impulse to pituitary, pituitary sends impulse to your ovary, and your ovary start your menstrual cycle. The menstrual cycle has two parts. In a regular 28-day cycle, it is usually divided into first 14 and second 14 days, which means that the first cycle is the first half of your cycle is the ovulatory cycle. The body prepare करती है egg release करने के लिए, right? Once on the day 14, egg is released, the level of estrogen and mammostery, there is a fall in the level of estrogen. Remember, there is a fall. None of the hormones are zero ever in a normal menstrual cycle. There is a decrease in level of estrogen and rising level of progesterone. And ultimately, the body is from the day you get your period, from the day you start menstruating, your body is preparing you to carry a baby. Remember that. So this cycle is definitely designed so that your womb is healthy. If at the end of your period you conceive, then it is receptive to hold an embryo. Okay, so on day 28, when you, for young girls, when you don't conceive, then there is decrease in level of estrogen and progesterone both and we menstruate. So, why are we here today? Why is this Mentee program is discussing this topic today? See, there is a reason for everything. As you are growing up, as we are moving from adolescent into adulthood, your body will be facing many challenges, physical, mental I can say as emotional too. And remember, the only thing that can groom you, that can help you, is being insightful. आपको हर चीज की नॉलेज होनी चाहिए और आपको मेच्योरली हर स्टेप पे बिहेव करना चाहिए. Rest everything is fine. I don't ask you to do anything that is not being allowed to you legally once you are an adult. But be mindful. So let's start with reproductive tract infection. When I talk about reproductive tract infection, it means infection of, if I talk from external to upper reproductive tract, it means infection of either the external genitalia
or the lower part of reproductive tract, which means your vagina and cervix, or the upper part, which is uterus, tubes, and ovary. The infection is not limited to these structures only. There are nearby structures too, which can get infected. So there are certain, God has blessed us with certain protective barriers at every level, be it male, be it female. You are blessed with certain glands, certain secretions, certain hormonal combinations so that you are protected from any form of infection. Just the second slide and I'll let you know where to move the slide.
Yes, ma'am.
So what are these protective barriers? Externally, the areas are enclosed so that no infection can offend your body. So girls who have any problem related to opposition of labia, yes, it is a matter of concern. But don't Google it and decide diagnosis. Consult somebody. Then when we move into the vagina, there are certain glands by the name of Bartholin glands. They secrete certain substances, certain secretions that help you maintain a healthy vagina. Then there is a bacilli by the name of Daulat bacilli, which keeps your vaginal pH acidic. Then estrogen, at the end of the day, we all are females because of estrogen. If there would have not been estrogen, we would not have got that skin, those curves, those looks that we crave for. Neither the menstrual cycle nor anything. So feminism is directly proportional to estrogen, but yes, in general. Certainly, whenever this range is reached, as doctor mentioned, hyperestrogenism is always a concern, and hypoestrogenism is a concern. But having estrogen in your body is equally important. So estrogen helps you maintain your vaginal pH along with uterine bacilli and Bartholin gland. Similarly, in the cervix, there is a mucus plug. Normally, also we get vaginal secretion. Having vaginal secretion is absolutely normal. Remember that. Don't think that if my friend is having a vaginal secretion and she is having a disease, I am having it too. Vaginal secretion is not synonymous with vaginal disease. It is not synonymous with vaginitis or cervicitis or PID or any of those diseases. So mucus plug is there in the vagina and it is protected. Then as we move upwards, uterus sheds every month, again in a name to protect you. Okay, then there are fallopian tubes. Those tubes have cilia, they have fine layers that helps in propulsion of egg as well as any other foreign body as I come along the organisms, be it bacteria or parasites, they help in deharboring those organisms in your tube, thus preventing the disease. Next is the ovary. Ovary has many protective mechanisms. The cycle.
इसमें नहीं चल रहा
So, before I started, let me just
नहीं चल रहा ना presentation.
any one of you can participate in this session. What do you want me to cover? What do you want me to discuss? Anybody? What do you want to discuss today? Come on. Like I said, no question is a wrong question. Safe sexual practices one. Vaginal discharge two. Next.
Mostly, young girls have a kind of problem where, white kind of fluid is not just a mucus. It's like, and sometimes it may have smell, sometimes it may not have smell.
Okay. So we'll,
Whether it's a fungal or whether it's something else.
so we'll be discussing vaginal discharge. What else? Ectopic pregnancy. Very good. What else? Two topics.
Ectopic pregnancy.
Process. Other than physiological cysts, normal cysts which are there, like para-ovarian. Okay. Non-ovarian cysts. Reproductive tract, non-ovarian cysts. Okay. So, okay. What else? Shakti. Adi. Thank you. This vaginal, what else?
Ectopic pregnancy.
Scar endometriosis.
As you come across more communities, most welcome. So I was talking about the genital tract. So these are the preventive barriers which are there in your genital tract. Whenever these barriers are breached, you get infection. And reproductive tract infection is a scientific term for the same. Whenever there is breach in these barriers, organisms ascend, they infect your body, and you get the disease. Okay, that is why we have designed this program so that we can make you aware about the difference between sexually transmitted infection and other reproductive tract infection. What are the common symptoms? When to seek an advice from a doctor? What are the safe practices that you can do? All the preventive measures and therapeutic options, those are available. The myths and the facts behind reproductive tract infection. So we'll be covering one by one these things. First, let me start with the complications. Why are we worried? Okay, infection होता है, बुखार होता है, ठीक हो जाता है. Why are we worried about these infections in specific? This is because these infections are not short lasting. If somebody gets an infection of reproductive tract, it may affect your fertility 10 years down from the day you got your infection. If your tubes are damaged, then later on one can have ectopic pregnancy, one can have subfertility, difficulty in getting pregnant, and the tubes may get blocked. You may have chronic pelvic pain that is not responding to any medication. Every now and then you may experience that pain. Difficulty or painful sexual contact, difficulty in passing urine, difficulty in passing stools. So the disease is not limited to the period when it has hit your body. It has a long-lasting effect. Chronic diseases, these are not always ceasing at the acute interval only. And yes, last but not the least, infections can even lead to cancer later in life if they are untreated. So let's talk about the diseases one by one. Next slide, please. So the genital tract can be divided into lower genital tract and upper genital tract. Lower genital tract includes your vulva, vagina, and pelvis. And upper genital tract includes. Am I audible?
Yes, ma'am.
Okay. And upper genital tract includes your uterus, tube, and ovaries. Sexually transmitted infections are not limited to females only. Let me just be one family partner, right? Not to be. So I hope I'm not increasing the boredom, but please remember that sexually transmitted infection is always relevant to both partners. Why have we distributed it in lower and upper genital tract? It is because the diseases, the symptoms, the severity are different. Lower genital tract infections include number one, infections of external genitalia, which means labial infection. Labial infections, it is known as vulvitis. What are the common symptoms? How can you see that okay, this is some infection? First, constant itching in the vulva. Second, ulcers. Ulcers or blisters in the area which may or may not be painful. Third, burning sensation, burning or pricking sensation. You may just have constant burning and pricking sensation over months. This is one of the very specific kind of herpes. Herpes A doesn't have burning only. No other symptoms, no alpha, no nothing, but just burning. Next, flash dysuria, which means just after passing urine, you will feel that burn. A sensation of burning after peeing. This may be experienced by male and female both. Flash dysuria is a very common and a very pathognomonic symptom of any genital infection, or any visible swelling or any visible lesion in the genital. So, what could it be? The diseases that affect your vulva are number one, skin conditions, number two, non-skin condition, non-dermatological condition. So, if your doctor is treating you constantly and you are not getting relief, if you have taken antifungal, you have taken antibiotic, and still you are having the symptoms, please see a dermatologist. It could be a systemic disease, a disease of the body that is affecting your genitalia too. Skin conditions may cause constant vulval or external genitalia symptoms, which means itching can be because of generalized fungal infection. It will not be a vaginal infection. Itching can be because of certain autoimmune diseases also. So if you get any of these symptoms, yes, never to forget worms. Do deworm yourself once a year. Please, this is mandatory. Deworm yourself once a year. It may present as very itching or burning in the genital region. So as we move from vulva to vagina, as ma'am has asked, the most common symptoms of the vaginal infection are vaginal discharge or live discharge. Discharges are the most common symptoms. These discharges, so okay, anybody can tell me what is a normal discharge? What is normal? Few minutes back I said that discharges can be normal. Now I'm saying it is abnormal. Understand, there is a definition of normal vaginal discharge. A vaginal discharge which is during your mid cycle is normal. Just before your period, if you are getting thin discharge, it is normal. If you are getting discharge which is there, but it is not copious, copious means not more in amount, if it is not foul smelling, if it is not itchy, if it is not associated with any redness or swelling, then it can be a normal vaginal discharge or a normal discharge in both male and female. So discharges are normal because we have lubricating glands in our body that are mandatory to maintain the health of vagina. So any discharge, now mark my words, any discharge which is lasting for more than 2 weeks, which is foul smelling, which is itchy, which is copious, more the amount, how do you measure less and more, if you have to use a sanitary pad for your discharge also, if you are having that amount of discharge, then it is certainly abnormal. If you are having greenish or creamish discharge, if you are having curdy or cheesy discharge, something like curd, something like cheese, yellowish, the color of pus, if you can say. These discharges are not normal discharge. These are all abnormal discharge. Now these abnormal discharges can be because of a disease which is localized to your vagina and cervix, or it could be because of a disease which is sitting inside the uterus and producing a discharge from there. So why have we segregated these two? Because the diseases of the upper tract are mainly considered as PID or pelvic inflammatory diseases, and they are the ones that cause long-lasting damage. Diseases of lower genital tract are usually short-lasting and they are more easily curable. So any discharge, as I have mentioned, that is not in the normal window is abnormal discharge. Similarly, blood stain discharge is never normal if it is not happening in and around period. If I talk about ladies in the perimenopausal and the postmenopausal age group, then mid-cycle bleeding, postmenopausal bleeding, if you have had no periods for good 6 months to 1 year, and one fine day you start getting regular periods, please take your aunt, your mom, or anybody who is experiencing that to a doctor. Because postmenopausal bleeding, as I mentioned before, could be because of endometrial hyperplasia, which may lead to from vagina that moves to cervix. Cervix is an organ which is the lower part of the uterus. If you know that the lower part of the uterus is known as cervix. And there are two, if I'm not wrong, this is the fifth year running since we are struggling to eliminate cervical cancer. Whole gynecological fraternity is after it. We are trying our level best, and there is a simple two vertical approach to deal with this disease. First, get your pap smear done, and second, get yourself vaccinated. These are the two main modalities that you have to be. Just keep it in your mind, share it with everybody, read it, make yourself aware. HPV vaccination, human papillomavirus, is the virus that causes cervical cancer in 8 out of 10 cases. And after breast cancer, cervical cancer is the second most common cancer which is killing females worldwide, especially in India. So cervical cancer prevention is offered by HPV vaccine. Then HPV vaccine is given to both girls and boys. It is better to be given before you attain your life, before you start your sexual activity, because once you're sexually active, you are exposed to human papilloma. It's better to take a vaccine before you are exposed. Once you are exposed, but it is always better if you take this vaccine. All those in the nascent stage. And why for cervical cancer we are having screening? Because we can see the cervix. This is an organ which can be visualized by eye. We cannot do stomach cancer screening because we cannot see the stomach. But thankfully we can see the cervix, and there is a screening protocol which says that every girl which is sexually active must get her cervical screening done every 3 to 5 yearly. Why I say 3 to 5 yearly? 3 yearly, if you are not getting a co-testing with HPV, human papilloma virus, but if you are getting a co-testing done with cytology and HPV both, then you need to repeat it every 5 yearly till you are 65. As per the recent guidelines, till 65, every woman must get her cervical cancer screening done at 3 to 5 yearly interval. This is something that all of us should know. We all get it done. Tell your near and dear ones that yes, and this is free available in every center. Be a government hospital, a private center, the method, the technique vary, but it is available everywhere. Okay. So for cervix, I just need to point out two things. First, get yourself vaccinated. Second, get your screening done. Let's talk about uterus. I was talking about diseases. Then there are many diseases that affect the uterus, and they are the most harmful ones. And these diseases can be caused by virus to a female partner or vice versa into sexually transmitted infections. Those diseases that can be transmitted by sexual contact. Other reproductive tract infections are also there. They also need equal attention, but it is very difficult even for us as a doctor between the two by looking at the symptom or just by looking at the examination while examining you. So, if you just move back, move a few things back, move back. Sexually transmitted infections that spread through sexual contact are the ones that spread through sexual contact. They can be caused, as I mentioned, they can be caused by bacteria, viruses, or parasites, and it can affect both men and women. STI, as we call it in medical terminology, can be transmitted through vaginal, anal, or oral sexual contact, as well as through skin-to-skin contact with infected areas. Now, here I would like to emphasize that skin-to-skin contact with infected areas, anything that we should remember. It is not that if you are having, if somebody is having a sexually transmitted disease, he or she cannot touch a person. No, please no. It is the part, the skin, if the skin is bleached, if you have a cut, if you have a raw area, then that area is prone to get infected. That is the need. It is important to practice safe sex and get tested regularly to prevent the spread of STI. Next, please. So there are many viruses, bacteria that can affect your body, but the important ones, the four important ones, I would like to highlight over here. They are chlamydia, gonorrhea, herpes, and human papilloma virus. These four, all of you must know, understand, recognize the symptoms, and please seek help if you feel that any one of you are going through this. See, as per the law, who will tell me what is the I'm not talking about legal age for marriage. We are talking about so boys and girls they have same age for sexual majority till contact with necessity. Earlier it was something else.
16.
Okay. Right. So earlier it was 16, but now it is 18. So why this cutoff? Why not 28? Why not 20? Why not 50? Why 18? It is not that one fine day people, the government lobby has got us and designed this. It is because your body is prepared and matured hormonally, and before that you are young, okay, to indulge in sexual activity. That's why this age has been given. This has read about it. There is a big, there are many studies supporting the 18 cutoff. Okay, we all agree, but it is a mental maturity to understand the sexual behavior of your body, to accept, to enjoy, and to 21st century where you have AI, where you have exposure to all possible information that you know. Read, understand, but don't overread and under-understand. So there being sexually active, there is no harm if you are an adult, you can be sexually active. When you over here, the government allows any adult to pursue his or her sexual behavior. Mention that poor hygiene is one of the very common causes. Can include discharge from penis and burning during urination. Abdominal fever, abnormal vaginal discharge, and at times swelling or lumps in the genital region. Similarly, in men mostly have vaginal discharge. Common term, we all have heard this term, though we viral disease is caused by which virus? Herpes simplex virus. Excellent. How many types of herpes do we have? Virus type 1 and herpes simplex virus type 2. What is the difference? One is less severe, two is more severe. Two is more number? No. It is because the type of virus that is affecting your upper part of the body is different from the one which is affecting your lower part of the body. So genital infections are mainly caused by herpes simplex virus type 2. And herpes disease, it is one of the diseases which is symptomatically very I should say uncomfortable because it has variable presentation. It can present with burning, it can present with pain, it can present with small ulcers of depth, it can present with and type 2 are different. Remember, if somebody is having cold sores or somebody is having herpes labialis, don't think that he or she is having herpes, now it is genital herpes, it will be sexually transmitted. No, one is different, it affects the upper part of the body, and type 2 is the one that causes genital disease. And herpes in women presents as painful sore or blisters on and around the genitals, anus, or herpes type 1 around mouth. Many a times we see in my OPD, I come across girls who have undergone many treatments for they have non-specific complaint, vaginal pain, there is no lesion visible. Okay, many a times they say that it is psychosomatic, we give antibiotic, this, that, and then after a period of 10-15 days, you realize it is herpes and it is called antivirus. So the treatment of herpes is antivirus. Human papilloma virus again. There are about 100 types of HPV, and out of these, 40 to 45 affect genital organ. Out of these 40-45, there are 13 to 16 which can cause cancer. So human papilloma virus, for your information, it can cause two things. First is so genital warts are also caused by human papilloma virus. So what are the symptoms of human papilloma virus in women and men both? It can present with either they will be harboring it without any symptoms, and while you get your pap smear done, you may understand that okay, this is genital wart, or later in life it can present as cervical cancer. So what is the best way to prevent any sexually transmitted infection? Anybody know what is power of one? What is power of one? What is the meaning of power of one? We use it this term. So power of one means that if there are affecting one particular event, then out of all those factors, there is one factor which you have to choose. If you correct that one factor, most of the factors will get auto-corrected or decreased. That is known as power of one. So even for why if I talk critically, if I talk as an entrepreneur, then even in business sector, even in medical sector, every time you have to recognize your power of one. Sexually transmitted infection, the power of one is only one, and that is safe sexual practices. The only thing that can help you, that can save you, that can groom you is safe sexual practices. What do I mean by Safe sexual practices. Safe sexual practices means I'll contradict ma'am a bit. So safe sexual practice contraceptive pills, chart the list for contraception. So remember, what ma'am said is that try and understand the pills are to be used only and only where they are indicated. Hormonal pill when it is indicated for a particular reason in your body. So it is risk versus benefit. What benefit are we seeing? Many ifs and buts. There are all those side effects coming to play like Ma'am was mentioning. But those effects are mainly seen post 35. 35 is the cutoff. 35 smoking, poor lifestyle, already a precipitating disease. So we have to see in total. Because even when the doctor is prescribing you a hormonal pill, she'll ask you whether you have migraine, whether you have a liver disease, whether you ever had a family history of stroke, ever had a family history of migraine, heart disease. So when you are negative for all these things, then only a pill is prescribed. So now contraception is being offered as a cafeteria approach. What is a cafeteria approach? So when you go in a cafeteria, you get we offer the couple everything. See, these are the options for your age group available. Kindly pick and choose as per your convenience. We'll be telling you effects and side effects and failure rates of the one that you are choosing, but the final choice is you. And why is that so? Because none of the contraceptives, other than the barrier ones, are sexually active. But you remember, be the boy, be the girl, there is no harm in carrying a barrier contraceptive. Please remember that. The boy is responsible for barrier contraceptive, girls can carry barrier contraceptive too. There is no harm. Oral contraceptive pills. So these are combination of estrogen and progesterone. Nowadays we have low dose and very low dose contraceptives. And depending on what you have, suppose a girl is having PCO. And for PCO, because of some indication, the doctor has to start a contraceptive pill. So that contraceptive pill is going to treat your PCO and it is going to give you a contraception. So advantage. Similarly, if somebody is having a cyst, many a times for cyst also we give hormonal combination. So contraceptive pills are to be taken after discussion with your doctor, after you get yourself screened, after you have no negative factor or contraindication which comes under the contraindication criteria for hormonal contraceptive pills. You can go ahead, pick, choose, discuss with your doctor, and for your age group, contraceptive pills can be safely given for 10 years. Let me repeat, it can be safely given for 10 years. Now, there is, don't think that the man has just said 1 year and I am saying 10 years. No, I understand it. It is when indicated. The term is when indicated. If I talk about a lady who is 35, I will not give it beyond 5 years with regular screening. But for young girls, if I take somebody else's example, when I was in my college days, I have taken contraceptive safely for many years. Most of my colleagues have taken. So contraceptive pills are safe drugs if taken under supervision. 3 months, give a break of 2 months, then restart it again. The latest guideline says that every time we stop and restart the pill, there are more chances of heart disease. So pills, when started, should not be stopped and restarted. Every time we give a pill-free period and restart it again, the cardiovascular risk increases. So, whenever you are thinking, if you feel that, okay, I am not benefit of contraception and taking a tablet is easier for me, then please go meet your doctor, discuss, and then start it. Risk and benefit, yes, it has risk and benefit, but it is, if I talk from a gynecological perspective, it is a safe medicine. The combinations which are now available are ultra low dose, which gives you contraception with minimal side effects. Yes, certain side effects that ma'am has mentioned, breast tenderness, nausea, vomiting, soreness, they are there on 3 monthly basis. They provide you with contraception, but again they have a problem of intermenstrual bleed or irregular cycle. So you have to introduce this. As I mentioned, it is a cafeteria approach. I'll just enumerate the ones which are available. Condoms or guided contraceptive, both male and female, oral contraceptive pills, injections, implants. There are implants. Then there are, in India, we don't get those patches over the counter. It is not really available over here still. But patches are there. Then there are creams. Contraceptive creams are also there. Contraceptive. There are various combinations of estrogen, progesterone, and non-estrogenic and non-progesterogenic pills too, which gives you contraception. Tablets, injection, implants, diet, these are the common ones that are available in the market. But you have to go discuss as a couple that what do you want. But still, there is no substitute for carrying a barrier contraceptive whenever you are. If I have any question from you about contraception, you may just ask. Any doubt? Yes, yeah. Why is it so? This is because what man has said. These contraceptive pills have very proportion of estrogen and progesterone. Stress level, as you mentioned too. So yes, this is one of the contraindications if somebody is under treatment for any anxiety depressive illness. Emergency contraceptive pills are not contraceptive pills. The word emergency is there with them. Emergency, I come across girls who take emergency contraceptive every time they are sexually active. Month on month, they are buying. I'm not taking the brand name, but they are going, buying a single tablet and the day of their partner, and they just take it and be like they are safe. No. Emergency contraceptive is a high dose progesterone. Remember that. It is going to disrupt your menstrual cycle for next 2 to 3 months. It is to be taken over has bleached or do I never advocate that or if somehow you have forgotten to use a contraceptive. That is the only condition where you use emergency contraceptive. They are pills which contain progesterone. What you will do? They are better to be taken within first 3 days of sexual unprotected sexual contact, which is 72 hours. Sooner the better. It should be taken. And many girls who get pregnant even after taking emergency contraceptive. Don't think that if you have taken emergency contraceptive and you have missed your period, you need not take a pregnancy test. No, it is not 100% protective. There are many confounding factors to it. So you should be alert enough. And it is to be taken only. Not there is a criteria, there is a full booklet which has been designed, which has been written, mentioning the not using barrier contraceptive the way it should be used. Then yes, the failure rate will be high. Similarly, if you are the way they are, the protection to the maximum can be achieved if you are using it the way it is used. Any more question on contraception? Okay, so
This is for these guys who we cannot ask you, but sometimes the market and marketeers they are authorizing the hygiene wash, body wash. Is this the vaginal wash or nail microsurgery is and other things? How safe are those and are they going to use the and the vagina?
So I was after conversation, I was just going to cover this topic on myths and facts. The first myth is that ma'am has said, when the eye vagina goes inside your vagina, so just stop thinking that if you are using your vaginal wash daily, you are maintaining a good vaginal hygiene. No, absolutely no. They are perennial washes. What are vaginal washes and what do we expect from vaginal wash? Vaginal washes are to be used only when you are having an infection. Why? Because the normal pH of vagina is 3.5 to 4.5, which is maintained by daughter and bacilli and estrogen. They convert the glycogen to lactic acid, thus maintaining an acidic pH in the vagina. Whenever this pH moves from acidic to basic, as during menstruation, as while the lady is lactating, as after menopause, you are more prone to infection. How do we treat it? We treat it by traditional antibiotic, antifungal, or any the organ specific medicine and vaginal washes which are given by your doctor. You cannot do a vaginal wash by your own. So perineal washes, they have to be used maximum for a week, 6 to 7 days is the maximum duration when you use it, and it is to be used externally only. It is just cleaning your external perineum. If you use it on regular basis, it will alter your vaginal pH and make you more prone to infection. So we never recommend, the doctors never recommend vaginal washes to be used for vaginal hygiene on regular basis. Second myth, how do we maintain vaginal hygiene? The correct way to maintain vaginal hygiene is to use vaginal wash. Again, it's a myth. Remember that vaginal hygiene is maintained by regular bathing, number one. Number two, keeping yourself clean and moisturized. That is the only way to keep your vagina clean. You need not do this again and again. You need not apply any cosmetic or perfume-based sprays over there. These are just myths. Third, some myths within keeping our sleep. So, we have talked about vaginal pain. About let's talk about the menstrual methods which are available in the market. Sanitary pads, sample, menstrual cup. Which is better? Menstrual panties which are available. Which sanitary method is better? Menstrual pad, sample, cup, reusable panties, with the bottom of cup. Raise your hand. Samples. We use that. If you are using sanitary pads, badly dispose it by wrapping it in a newspaper and throwing it in a dustbin. And never. The bigger tampons have more of the sanitary pad. If left inside next, cups. Beautiful way of menstrual hygiene. Cups, if used properly, nothing better than that. But you should know how to use it, how to sanitize it. You should know to wash and reuse it. If you are using it properly, they are very convenient. Girls are going for swimming these days with menstrual cups. It is absolutely seal-proof if used properly, but you have to individual. आपका फ्लो कैसा है, आपका वजाना का कैलिबर कैसा है, आप कितना यूजर फ्रेंडली है उस पर्टिकुलर मेथड के लिए. Reusable panties again they are good methods can be used. Okay, PID can lead to ectopic pregnancy. Ectopic pregnancy means when the pregnancy and not in the uterus. It can be life-threatening. The tube may burst and you may need a emergency surgery. So PID today can lead to ectopic 10 years down. Always remember. So safe sexual practice, and safe sexual practice. Again, vaginismus. So vaginismus is a very technical term and has to be diagnosed by a doctor only. Just having difficulty or pain in sexual contact is not vaginismus. There is a definition. Okay. When the tone of the muscle is high, there is a basal tone, then which is leading to difficult insertion, that is vaginismus, and it has a different treatment modality altogether. Just having difficulty in initiating sexual contact, that is not at all. It is a technical term, it has to be diagnosed by a doctor. Scar endometriosis. Endometriosis means presence of endometrial tissue outside the uterus. So, the uterus has three layers, muscle. So the inner lining of the uterus is known as endometrium. So when Endometriosis Committee of India, we are working day and night to make everyone aware about painful periods. So remember, pain hota hi hai, wala concept has died off, hota hi hai, because endometriosis again is a chronic disease. It can affect, it can ruin your obstetric history badly. It can destroy all the pelvic organs, be it your urinary bladder, your rectum, your uterus, everything. This is a deadly disease. So when this endometriotic tissue is present in a previous scar, suppose the lady has related, and because of some faulty technique or something, the tissue has come to the scar side. Then every time you menstruate, so the endometrial tissue responds to menstrual cycle and it is treated surgically. The only treatment is surgery. It has to be used. No medical treatment.
On the ectopic side, say outside the uterus, infection and backflow, things the peritoneum, maybe some tissue has moved back into the body, peritoneum and
There are seven theories mentioning the reason for endometriosis. One of them is retrograde menstruation that you are mentioning. So out of seven theories, one of them is the role or genetic during the development of the fetus. The endometrial lineage tissue is present anywhere else in the body and it multiplies and grows there. So presence of endometriotic tissue outside the female reproductive organ has led to these theories that it has a component of de novo origin too. Then one theory is retrograde menstruation, but if it is retrograde menstruation, initially it also seems ladies who are hysterectomized, who have got their uterus removed. Okay. So, and there are many other conditions also where it has been seen that endometriosis is present. The retrograde menstruation theory was not able to explain that. So there are many biogenetic theories which say that there is change in level of certain change at the microscopic level, at the cellular level, which has led to development of these ectopic tissues, these aberrant tissues, or as a result of previous surgery, while the surgery was being performed, the tissue has been implanted at a normal site. Endometriosis is still under investigation. It is still a debatable disease. Whenever we are there in the forum, still a lot of debate is going on. But one thing is very clear: the sooner it is diagnosed, the better the outcome. As soon as we diagnose endometriosis and we start treating it, nothing better than that. So, if I talk about what is a normal menstrual period, a normal menstrual period is one which lasts for 3 to 7 days with 6 to 7 pads in a day. Pain which is bearable, which is not hampering you to carry out your day-to-day activity. Fair enough that you have to take medicine every time or you are limit to attend your college or school, please consult your doctor. So these are the abnormal ranges, abnormal manifestation of menstrual period, and please take biggest myth that we are not supposed to take painkiller when we have pain. Remember that menstrual pain, the painkillers that are available, those are anti-inflammatory also. They subside inflammation also. They are not only painkillers. So if it is recommended in your case, please don't have a hitch. Have a good quality of life. Today we expect girls to be as efficient as boys. Everything is treatable nowadays to make you comfortable. Please seek help, talk to your peer, talk to your teacher, please talk. Practice